Justice Godwin Abraham. We welcome and celebrate you, sir. Thank you. We also have in our midst the head of civil service, Akwa Ibom State, the elder Effiong Essien. Let's put our hands together and welcome him. And of course, we have honorable commissioners who are here. Let me especially acknowledge the presence of the Honorable Commissioner, Ministry of Health, Akwa Ibom State, the Professor Augustine Umor. Please let's put our hands together and welcome him. We welcome all distinguished guests that are here. We have in our midst the Honorable Commissioner of Police, Akwa Ibom State, CPM Yengeme Andrew, who is here. We celebrate and welcome you, sir. We also have the Sector Commander, Akwa Ibom, Federal Road Safety Corps, AA Amor is also here. We welcome you, sir. We celebrate you. Thank you. We have the Paramount Ruler of Uyo Local Government Area. We welcome and celebrate you, sir. And of course, we have the members of the Akwa Ibom State House of Assembly. We have permanent secretaries. We have chairmen of board and extra ministerial department. Other very top government functionaries here who are here and strategic leaders. Let me recognize and welcome very specially the technical partners who are here with us for the purposes of the flag off of this vaccination program. We have representative of the World Health Organization here. We have representative of the National Primary Health Care Development Agency. We have the NMA, we have UNICEF, and I'd like us to put our hands together and welcome all of them. We welcome you. Thank you very much. It is intended to be a very brief event, more of actions, less of speeches. But to get us started very properly, I'd like to at this point invite for a welcome address the Honorable Commissioner in charge of the Ministry of Health, Akwa Ibom State, Professor Augustine Umor, to welcome us for this event. Please put your hands together as it comes to the microphone. Thank you.
The Secretary to State Government, here representing His Excellency the Governor of Akwa Ibom State, Honorable Speaker, House of Assembly, the State Chief Judge, the Head of Service, Honorable Commissioners, Service Chiefs here present, traditional rulers, I beg to stand on existing protocol here after. I wish to welcome all of us to this brief event here today. A very important one in the annals of our state and in our fight against COVID-19. Immunization has always been the last hope of humanity in standing up against non-treatable killer diseases that have ravaged man over time, especially viruses. Today, the world is lucky again to have been given a vaccine against the disease, another virus that is ravaging the world, the COVID-19 disease, and which appeared suddenly with a death toll, especially in the European and other continents that have been too scary. Our continent and our Nigeria has been spared to a large extent these scary deaths, but at the same time we must be up to speed to make sure that we use this modality that has been here with time to be able to control it. And so we are gathered here to flag off the COVID-19 vaccination in Akwa Ibom State with the hope that the disease will soon be a thing of the past if we all receive this vaccine and have a significant herd immunity amongst the majority of persons to protect us against developing the disease, or at least prevent us from having the worst forms of the disease. The state is aligning in doing this with other nations and other states in the Federation in doing this and in rolling out this vaccine. I want to particularly thank His Excellency Governor Udom Emmanuel the Executive Governor of Akwa Ibom State, for its role model fight against COVID-19 virus. We have witnessed record-breaking construction of a 300-bed isolation center at the Tungbang, a project achieved in a very short time. We have a state-of-the-art molecular laboratory, which many states do not have. Free treatment for individuals, as well as testing also for the diagnosis of these diseases is ongoing in the state. We are indeed very grateful. This ceremony is really a demonstration of government's belief and support for this vaccine. Top government functionaries and strategic stakeholders are here and have come out here to receive the vaccine, to also bear witness to the rollout of this vaccine and offer their support. This is a clear message that the vaccine is something to be accepted in the state. I wish to state that this vaccination process will be in 4 phases. This very first phase is mainly for frontline health workers. Will be for frontline health workers, which had started indeed some days ago. In addition to frontline health workers, we'll then move on to other health workers. Opinion leaders are seated here, top government functionaries. We'll also go to the security agencies who have been very helpful in the fight against COVID-19 by providing the necessary security. And in the next phase, we will then move to those senior persons and those above 50 years. From there, we'll go to those with comorbidities. We talk of comorbidities. This will include those with things like diabetes, hypertension, and other such things that predispose people to getting the disease and probably dying from it. I want to state that the National Primary Health Care Development Agency has outlined this very well because it's not possible for everyone to get the vaccine all at the same time. And these phases are being put out to really help in ensuring that we have an organized rollout of the vaccine. At this point, let me express appreciation to all the partners also working in the state to achieve the goals of having every eligible and vulnerable person to receive the vaccine. I thank in no particular order the World Health Organization, UNICEF, Family Health International, and others. Let me use this occasion also to thank my indefatigable workforce, the Ministry of Health, Akwa Ibom State, the State Primary Healthcare Development Agency, Local Government Service Commission, the Interim Management Committee, and all others who have been very helpful in the fight against COVID-19. My special thanks goes to the State Chairman of the COVID-19 Task Force, our hardworking and indefatigable Secretary to the State Government, Dr. Emmanuel Ekuwem. Please, can we give our Chairman a round of applause? We may not understand it, but since the outset of this disease and its leadership, a time there was that we're having meetings on daily basis, every night, and no one sleeping, taking care to make sure that this thing is brought under control. We are where we are today, therefore, because you led a team that had sleepless night, working round the clock, and charted a course during the more difficult times of the peak of the pandemic. Today, we are lucky, we have borne ourselves this far to be able to maintain the health of the state and be able to control the pandemic. We thank the National Primary Healthcare Development Agency that has spearheaded the bringing into the country of these vaccines for us. Akwa Ibom has received 69,030 doses of the vaccine, and the rollout process has begun, part of which is why we are here. I thank you all for showing up today. Please let me quickly add that we have enough vaccines for everybody, and the registration process is made in such a way that once you take this vaccine, anywhere in the world you stop and you want to show evidence that you have taken the vaccine, it will show clearly. And therefore, as you wish to take the vaccine, just stop by the table there, do a registration process. As you finish the registration process, the table there will give you a card. You take your vaccine. Once you take your vaccine here, you take back that card that will be given to you. A barcode will be placed on it, which is specific just to you. And that barcode, again, will be scanned at that point to register you, so that anyway, airport, wherever you go, if you say, I have taken that vaccine, it wouldn't be a matter for speculation because it will show clearly. We have enough for everybody, and we welcome you once again. Please, if there are any concerns, our team is on ground at the point over there on that table to be able to clear these concerns for you. Many questions have been asked. Is the vaccine safe? Very safe. Even those who ran away from it are coming back to it. I'm sure you would have been reading this on the internet. The vaccine is very safe, and we guarantee you that when you take this vaccine, you will be well, nothing will happen to you. The bulk of my staff is seated there, have already taken their vaccines, and they are still here to help us. Thank you very much for coming. God bless you all.
Very distinguished ladies and gentlemen, that was very reassuring, knowing how much information has been flying around left, right, and center, or to put it more specifically, knowing how much misinformation has been in the public space. One more time, can we put our hands together for Professor Augustine Umor, Commissioner for Health, Akwa Ibom State. Thank you. The people that are not clapping will not get vaccines. Please give me another round of applause, ladies and gentlemen. All of a sudden, everybody wants to get the vaccines. Your Excellency, here represented, distinguished ladies and gentlemen, we're going to take brief messages of goodwill on this occasion, and it will be from representatives of the different agencies of government and international agencies who are partnering with the governments at the federal and state levels to ensure that this particular process goes seamlessly. And I want to please appeal to all the people who will be speaking on this microphone to kindly limit their presentation to a maximum of 2 minutes each. Having said that, may I invite the state coordinator of the National Food Drug Agency, NAFDAC, Mr. Collins Sugedembe, to kindly come forward for his message of goodwill. Please put your hands together for him, ladies and gentlemen. Thank you very much.
Yeah, thank you very much. The Governor, His Excellency, the Executive Governor of Akwa Ibom State, ably represented by the Secretary to Government, all of that distinguished persons here, I stand under the existing protocol. We in National Agency of Food and Drug Administration and Control, we are sincerely pleased with the state government for this laudable event, because Akwa Ibom has always been in the forefront. We have been able to receive these vaccines, and they are the top gear so that the people in the state are protected. So we are thanking the state government for this laudable project. At least we have shown your commitment to ensuring that the people in the states are safe and are free from this COVID vaccine. COVID vaccine is safe. NAFDAC has already evaluated, and we have said that it is safe for use. And for the first time, it goes to the frontline people that are in the state. So we want to use this opportunity, and NAFDAC, we have been able to do our contribution by ensuring that the vaccine is, we have been able to, the Med app, we have been able to use the Med app to, Jesus Christ. Anyway, we have been able to do our own contribution by ensuring that this vaccine is registered and is safe for use. So with time, the state government will continue to partner with them to ensuring that everything goes well. Thank you very much.
Mr. Collins Ogedengbe, State Coordinator of the National Agency for Food, Drug Administration and Control, NAFDAC. Please put your hands together for him, ladies and gentlemen. Distinguished ladies and gentlemen, by midday on a work day, I would expect a better round of applause. Please put your hands together, ladies and gentlemen. And thank you, Mr. Collins, for sticking to the time allotted. Next, goodwill message. Technical Support and Desk Officer of the National Primary Healthcare Development Agency, Omaumi Daibo. Please put your hands together for her, ladies and gentlemen, as she comes up here to speak. Thank you. We'll take one from UNICEF after that, and then one from the Nigerian Medical Association, and we'll proceed from there.
The Executive Governor of Akwa State, ably represented by the state, the SSG, and standing on other existing protocol. I bring you warm greetings from the Chief Executive and Executive Director of the National Primary Healthcare Development Agency, Dr. Faiza Shaib. This day has been what we've been waiting for. We've known in the past year, we've been having the COVID-19 pandemic that has changed the landscape of the world in our thinking, in everything we have done. But thank God, the science is dynamic. We've been able to produce the vaccines. Our mandate as an agency is to make sure that Nigerians stay healthy, and one of it is to provide potent vaccines to all Nigerians. So we want to thank the state government for their support, for the proactive response to this innovation of giving the COVID-19 vaccines to our indigents. The Honorable Commissioner has been very proactive, so has the other state members of the ministry and the board. So thank you very much. God bless Akwa Ibom. God bless Nigeria.
Thank you very much. Your Excellency here represented, distinguished ladies and gentlemen. I have been reliably informed that the representative of the World Health Organization and that of UNICEF are engaged in other activities still relevant to this particular initiative. And so they are unavoidably absent. But of course, they send their goodwill messages. Let me at this point invite for a message of goodwill the State Chairman of the Nigerian Medical Association, Dr. Ime S. Udo. Please put your hands together for him, ladies and gentlemen. Thank you.
His Excellency, represented by the Secretary to the State Government, the Speaker of the State House of Assembly, the Honorable Chief Judge, the Honorable Commissioner for Health, the Head of the Civil Service, other members of the High Table, distinguished ladies and gentlemen. The Nigerian Medical Association represents a body of over 1,000 medical doctors in Akwa Ibom State and about 50,000 in the whole country. And we have been responsible for the healthcare and health of all the citizens of this country. You would recall the interesting part we played at the beginning of the COVID-19. And over the time, we have seen a lot of improvement in the response to the COVID-19. And today, we brag amongst our other state branches that Akwa Ibom State has one of the best response against COVID-19 in the entire country. We have seen in record time the establishment of a 30-bedded isolation center. We do our own testing here in Akwa Ibom State. Before now, we used to send them to other states to be tested. And we even are on record to be treating those who are having the COVID disease for free in the isolation centers. And I think this is something that the NMA is very impressed with and shows its support behind the state government and its fight against COVID-19. On the COVID vaccine, the national leadership of the Nigerian Medical Association is heavily behind the vaccination exercise. The national president has endorsed this activity, and it behooves on all state branches, including Akwa Ibom State, to also endorse the COVID-19 immunization activity. We believe that this vaccine is safe. We also believe that it's very potent, and we believe that this is the only way that we can win if it works. It's our only chance. We all know that COVID-19 is not treatable. There's really no known medication against it. And the only hope of humanity, the only hope for Akwa Ibom, is if we all receive this vaccination. And for that to happen, we must at least reach a herd immunity of 90%. That means 90 in every 100 must receive this vaccination for the whole population to be protected. So we are throwing in our own adverts and encouraging everyone to receive the vaccine so that our lives can change. Most of us are tired of putting on this mask. We are tired of not being able to shake and to hug each other. And we believe that we have a chance at reversing and going back to how it used to be if only we take up the COVID-19 immunization activities ongoing. Without further ado, I'd like to thank everyone for turning out for this activity, and we'll continue to support this activity. Thank you, and God bless us.
Please can we put our hands together again for Chairman NMA Akwa Ibom State. Thank you very much for those very reassuring messages of goodwill. Distinguished guests, ladies and gentlemen, we've come almost to the high point of this event where the flag off of the vaccination program starts in earnest. But just before that, permit me at this point to invite for his address the representative of His Excellency the Governor of Akwa Ibom State and the Chairman of Akwa Ibom State COVID-19 Task Force, the Secretary to the Government of Akwa Ibom State, Dr. Emmanuel Lekowem. Please put your hands together as we welcome him to speak to us at this event. Thank you.
Mr. Speaker, and other honorable members of the Akwa Ibom State House of Assembly that are here present, my Lord the Chief Judge, the Head of Service of Akwa Ibom State, the Honorable Commissioner for Health, and members of the Akwa Ibom State Executive Council that are here gathered, permanent secretaries, board and commission chairmen and members of those boards and commission, the Commissioner of Police, the sector commander of the Federal Safety Corps, the representatives of the National Primary Healthcare Development Agency, the rep of NAVDAC, the rep of WHO that should be on his way here, the president or chairman of the Nigerian Medical Association, Akwa Ibom State branch, my friends, my brothers, my sisters, ladies and gentlemen of the press. His Excellency the Governor of Akwa Ibom State is unavoidably absent. Some people were asking, the governor diseases have been successfully controlled with vaccination. Akwa Ibom State received its first consignment of 69,030 doses of the Oxford AstraZeneca vaccine on the 10th of March 2021, courtesy of the National Primary Healthcare Development Agency. Our frontline health workers have been sacrificing to care and treat our citizens suffering from COVID-19 have started receiving this vaccine. Precisely, this was started on the 12th of March 2021 at the Methodist General Hospital in Tumbang. So far, none has reported any serious or life-threatening side effects. If the majority of our population takes this vaccine, then the toll of COVID-19 on our life and health will reduce considerably. Dear Akwa Ibomites, let us, like other reasonable and scientifically minded persons, embrace the COVID-19 vaccine when it is their turn, because it holds the potential to reduce the burden of disease and death from COVID-19. As leaders in our different areas, we are hereby called upon to support this exercise in order to give confidence to our people and in so doing help to beat the COVID-19 and improve their health. As I bring this speech to a close, once I finish it, I'll do the flag up by getting the jab myself. The MC, I'll get it myself. And I would like us to, the MC, no, the chairman of NMA was talking about that we are tired of using this stuff. Yes, that is a fact. But as CNN will put it, you still continue to use it for some time and see how things will improve. Let me, before the flag off, thank members of the COVID-19 Management Committee of Akwa Ibom State. Like the commissioner said, we were working till 1 a.m. I thank Dr. Dominic Nyangokbong, the Honorary Special Advisor to the Governor on Health and the coordinator of COVID-19 in Akwa Ibom State, for his work, for his sleeplessness, for spending time in Ibom Multi-Specialty Hospital. Sometimes we work till 2, 3 a.m. 2, 3 a.m., he will be calling me at 3 a.m. So I thank members of that committee. They were sleeping 2, 3 a.m. The governor would not be asleep. 329 wards at that time in the control room, but one after the other. Tedious job. So, and nobody likes this stuff, I'm going to tell you the truth, but they call it new normal. And so that number of tests, look at me. In the last 1.5 months, 5 COVID-19 tests. For those of us who travel a lot. Before we went to get visa to go to Morocco, COVID-19 test. Before that, the governor said all members of ESCO, COVID-19 test. When we landed Casablanca, we arrived in somebody's country, that evening, COVID-19 test. 48 hours as per their own national regulation, moving from Marrakesh to Casablanca, COVID-19 test. When we landed Lagos, they said 7 days from date of arrival to be sure that you didn't bring COVID-19 into the country, COVID-19, all of which must be negative. To God be the glory, all of us were continually testing negative. You see? So it's better we do it, because this guy, they put all kinds of long spatulas into my nostrils, almost touching my occiput. So this will help to bring that to an end. This is the point. So on behalf of His Excellency, the Governor of Akwa Ibom State, Mr. Rudom Emmanuel, I hereby kickstart the COVID-19 vaccination campaign for top government functionaries and other strategic stakeholders in the name of God the Father, God the Son, and God the Holy Spirit.
Very distinguished ladies and gentlemen, the SSG seems to know where he's supposed to sit. I know him to be an engineer, but all these years of being State Task Force Chairman, he may have become an auxiliary doctor. And the way things are going, before we do AKTC, COVID-19 test, before you pass with your club and get into government house, COVID-19 test. Before you collect your salary at the end of the month, COVID-19 test. Before your wife will give you food at home, COVID-19 test. before the police will arrest you for an offense, COVID-19 test. Okay, that is a single jab given to the SSG. Okay, please put your hands together for the SSG. Mr. Speaker, sir, Mr. Speaker. Mr. Speaker. Chairman enemy, we can get but we are member make any pharmacy, but well, please, if you are not a medical personnel, please step back, please. Please. Excuse me, sir. You're blocking the cameraman, please. Please, sir. SSG, sir. Sir, there's another procedure after taking. Yes, sir. You won't have to go as far as Marrakesh or Casablanca. Mr. Speaker, thank you very much. Mr. Speaker, that way, sir. Thank you. Distinguished ladies and gentlemen, His Lordship, the Chief Judge, asking a critical question, which I will not repeat, but it is important. Madam, please, okay, if you just give some space. Because when the judiciary workers see that the CJ has taken, all of them will take. Head of the Civil Service, please. Thank you. Thank you. Honorable CJ, sir, if you don't mind, sir, you'll proceed down to where there is some more documentation. Head of the Civil Service, please. Sabu take, or Mate take, sir. Oh, okay, yeah, take. Okay. Bon, musique, t'as fiat que former que meditate. I'm asking a question. Commissioner for Health said those who have questions should ask. I've asked my own, sir. Morgan. Thank you very much, the Head of Civil Service, to proceed down there for the documentation. That way, sir. Ladies and gentlemen, Commissioner for Health, Akwa Ibom State, Professor Augustine Umor, a woman, the Professor of Medicine. You can be the way my work actually. But the nurses will not allow that. And it is important, the Honorable Commissioner for Health has an important information to give after now. And please, ladies and gentlemen, I will please appeal that we listen to the Honorable Commissioner for Health. There's some important information he needs to give about the second dose once he stands up from here, because he has directed the next person who will sit there.
Just after this, we would have the Commissioner of Police, Akwa Ibom State, CPM Yengeme Andrew, also come to take his vaccine. All right, please, at the point of registration, we're given tallies. We're going to come to it now. 1, if you're number 1, number 2, 3, and 4. Please, who is number 1? All right, please. Let's celebrate her as she comes. All right, so please, we'll take number 2. Number 2, please. Please, you just proceed, sir. Thank you. Please, number 3. Who is number 3? All right, please, the press should capture the SSG, who at this time is brandishing, if I may use that word, this vaccination card with the barcode. Please, that's very important documentation for this exercise. Number 3. All right, sir.
Thank you very much. I just want to let us know that the vaccines we are taking is a 2-dose vaccine. 2 shots, 2-dose vaccine. We have taken the first dose now. The second dose will come in 2 to 3 months' time. Since you have your cards and the registration done, this will link back to you. Information will be sent back to you at that time so that you'll be able to get the second dose. It is after the second dose that you would now will be deemed to have had full immunity against COVID-19. So this is just the first dose. Thank you very much. And after this also, we're going to have more of these vaccines that will be available to our people, especially health workers and opinion leaders at the local government areas. Please, the vaccines are free, and there's no reason whatsoever for anyone to charge monies for this. I also need to add that please, before you go, take a look at some of the posts that we have there. It provides information also against COVID-19. Finally, as with every immunization, you may feel a little pain at the site of the immunization. That's no problem. And if you have any issues whatsoever, just let us know using the COVID-19 numbers. Thank you very much.
People should wait for about 1 hour after taking the vaccine.
I've seen people going, but it's always advised that after taking the vaccine, you should sit down and wait at least another 10-20 minutes before going.